A very good morning to all present here. We, on the behalf of Satara District's Indian Association of Physiotherapists and Indian Association of Physiotherapists Women's Cell Satara District, would like to welcome you all for the panel discussion on Integrated Therapeutic Approach for Osteoarthritis on the occasion of World Physiotherapy Day celebration.
As we all know, World Physiotherapy Day is celebrated every year. Similarly, this year's theme is Prevention and Management of Osteoarthritis. This day focuses on the contributions on the work arena that physiotherapists do for their patients and community at large. Today's brainstorming panel discussion is going to focus on the risk factors, preventions, management of the osteoarthritis, which will be held by our panel discussions, who will be conducted by the hard-working physiotherapists who are working effortlessly and manages patients of the osteoarthritis. This discussion will be focused on bringing about the awareness about the preventative strategies and possible options for the osteoarthritis.
To mark the beginning of today's panel discussion, I take this opportunity to welcome all the panelists which have joined us today through the virtual media as well as here. To begin with, I would like to welcome Dr. Sanjeev Kumar Jha, President, Indian Association of Physiotherapists. We welcome you, sir. I would like to welcome Dr. Anna Malai, Secretary, Indian Association of Physiotherapists. Dr. Ujjwal Yevle, Maharashtra State President, Indian Association of Physiotherapists. I would like to welcome Dr. Rushi Varshini, National Head, Indian Association of Physiotherapists. I would like to welcome Dr. Suvarna Ganveer, Indian Association of Physiotherapists, Women's Cell Coordinator. Dr. Suraj Kanse, State Executive Member of Maharashtra State Indian Association of Physiotherapists. And Dr. Trupti Yadav, Satara District Women's Cell Coordinator, Indian Association of Physiotherapists. We have 6 panelists today with us here. I would like to welcome each one of them. To begin with, our first panelist for today is Dr. S. Anand, Professor Professor Community Health Sciences Physiotherapy. Sir is practicing since 1994 after his bachelor's degree and is a senior physiotherapist designated by MIAP since January 2020 conference. He has been a postgraduate guide since the year 2005 and has been working effortlessly for the Maharashtra and the Satara district, and has an experience of over 25 years. I would like to request Shivani Arya to welcome Sir. Our next panelist for today is Dr. Sandeep Shinde, College Convener of Research Cell and Associate Professor with a work experience of 12 years in the Musculoskeletal Department of Physiotherapy. We would like to welcome you, sir. Next, Dr. Suraj Kanse, working since the year 2010 with an experience of being Associate Professor for 12 years in the Department of Neurosciences. Sir is also an Executive Committee member, Maharashtra State Indian Association of Physiotherapists. We welcome you, sir. Next panelist for today is Dr. Amrutkaur Raizade, who is a member of Satara District Indian Association of Physiotherapists, presently working as an Associate Professor for Orthopedic Manual Therapy, and has an experience of 11 years in the academics as well as clinic. Moving forward, our next panelist for today is Dr. Trupti Yadav, in Satara District Women's Cell Coordinator, Indian Association of Physiotherapists. Ma'am has an experience of 8 years. Next, Dr. Vaishali Jagtap, ma'am, who is an Associate Professor in the Department of Community Health Sciences. Next, Dr. Rohit Barge. Dr. Rohit Barge, who is a sports physiotherapist and of Korega. We would like to welcome you, sir, for this today's panel discussion. Next, Dr. Pallavi Kulkarni, who is a Women's Cell Sub-Coordinator of Maharashtra State Indian Association of Physiotherapists. Ma'am is a neurophysiotherapist by profession and a founder and owner of Arogyam Physiotherapy Clinic, Satara. Dr. Chinmay Deshpande, sir, who is a community physiotherapist working effortlessly to provide service to the community in the Satara district. We would like to welcome you, sir. For a panel discussion to be carried out very efficiently and very smoothly, there is always a need of a moderator who helps us to carry out the discussion very effectively. So for today's discussion, we have Dr. G.Varadharajulu, sir, as the moderator for today's function. To speak about Dr. G.Varadharajulu, he has 26 years of professional experience in administration, teaching and clinical areas. He's basically from Tamil Nadu, graduated in physiotherapy in the year November 1996 from Tamil Nadu, and post-graduation in physiotherapy in MPT Neurosciences in the year July 2002. Sir is presently pursuing PhD in stroke rehabilitation. Work experience is for 26 years, and Sir has been awarded as a Distinguished Service with the Distinguished Service Award at the 54th Annual Conference of Indian Association of Physiotherapists, which was held in the year 2016. Along with that, Sir has always also been awarded as the Best Physiotherapist Award in the year 2020. We welcome you, sir.
We will begin this panel discussion with lamp lighting as a tribute to Ma Saraswati to bestow her warm blessings to achieve future achievements. I would like to request all the panelists from today's discussion to kindly proceed for the lamp lighting.
Thank you, everyone. We would now like to request Dr. G.Varadharajulu, moderator for today's panel discussion, to kindly take over.
Very good morning to one and all who are present here for this panel discussion. In absentia, Dr. Sanjeev Kumar Jha, President, Indian Association of Physiotherapists; Dr. K.M. Annamalai, General Secretary, Indian Association of Physiotherapists; Dr. Ruchi Varshini, Head, Women's Cell of Indian Association of Physiotherapy; and Dr. Ujjwal Ivale, President, Maharashtra State of Indian Association of Physiotherapists; and Dr. Suvarna Ganvir Madam, the Head, Women's Cell, Maharashtra State; and all the executive members of IAP, National and State, and all the Women's Cell of Satara district who are very active, dynamically working for the betterment of creating the awareness of this profession in this locality. So it's my great pleasure and privilege to be as a moderator for this much needed topic of this year's World Physiotherapy Day theme of osteoarthritis. Dear one and all, the osteoarthritis has become very important topic of the discussion for all physiotherapists across the world. Okay, the reason behind this topic to be a talk of the town today is that its prevalence, the consequences, and it's the how do the patients they suffer in the country. So these are all made the physiotherapist in the globe think of a topic on this topic need to be talked by every person, whether they belong to student physiotherapy or whether they belong to the practicing physiotherapists, whether they are academicians, where they are administrators, or whatever their role they play. So the World Physiotherapy Day, the entire physiotherapy globe thought of this topic to be to discuss in the form of as a theme of this year celebration of World Physiotherapy Day. So regarding this only, as a part of continuation of celebration of this district, that is Satara district, which is a part of Western Maharashtra. So we, the practicing physiotherapists in this locality, with having the good number of experienced therapists around the Satara. So we thought of taking this as one of the topic to be discussed in the form of panel discussion, where this condition has to be observed in the part of like whether this condition can be treated in the is solely by a single specialist, or it does require this condition really requires an integration of other therapists to manage this particular condition very well. So that is the intention of this discussion. That is the intention why today's topic of discussion is the integrated therapeutic approach for the osteoarthritis. So usually in the practice, in the public, we say that the osteoarthritis people generally they referred from the orthopedic surgeon. They come to nowadays they come to an orthopedic physiotherapist. Otherwise previously they used to come to a general physiotherapist. Whoever physiotherapist they go to them, and the orthopedic surgeon based orthopedic physiotherapist or general physiotherapist based on the symptoms they try to manage. Of course they get a good result and they are improving also. But when you think about the quality care, or the quality care never ends only at the phase of intervention. It has to be taken into much more deeper. That is where the panelists have been gathered here to discuss about the topic. So before going into the topic, since the public, we wanted the message to be given to the public who are seeing this particular discussion in the mass media, in the TV and other channels. So I wanted to say that what is this profession? Okay, I would like to I take the privilege of introducing the profession as such kind of a good platform. So physiotherapy profession is a very important upcoming medical professional course, and it is just a 75-year-old profession. Okay, it is just a 75-year-old profession, and it's gaining its importance from past 30 years only. So if we say the age of the profession is almost like age of the panelists who are sitting here. Okay, so we can say all are belongs to the 30 year of the world sitting here or door in the online also. It is just we can say the profession has been in force, in action for the past 30 to 35 years, maximum 40 years. Before that, it has taken its own pathways to make the public to awareness. So this profession is very, very important profession and much needed. And this profession, it has started with a diploma program in the beginning, and it has developed to the level of bachelor degree with 4.5 years, which is at par with the medical MBBS, BDS. And it has got a master degree. Initially it used to have a general specialty. Now master degree in specialties, like about 10 specialties are there in the profession. And the professionals who are getting the graduation, post-graduation, master degree, doctorate degree in this, they are all doing their best services in the country. And this profession is, though even after the 75-year-old of its existence, still we call it as a profession is in the budding stage. And so budding stage, the reasons are only 3-4 reasons. One is still it is in budding in the awareness among the layman. Okay, so if this profession has to reach the unreachable people, and in that area, that way we are in budding, and we are still in budding of producing the evidences on our practice. So on evidence-based practice, still we are in budding stage, and the researchers that we are supposed to take up in timingly, in that we are budding, and setting up an independent practice by the physiotherapist across the world, still we are in budding stage. So if we say the budding stage only in this area, otherwise the profession has reached the people, profession has taken its importance in the public, and it is the each and every physiotherapist responsibility that we are to break through this budding stage, and we should take our profession to the next level. So dear viewers, dear participants, dear stakeholders, who is this physiotherapist? A graduate physiotherapist is supposed to be a 4.5-year-old degree holder, and he should be from a healthy university, and he should be a registered Indian Association of Physiotherapists. He should be a state council member. He will only be called as a qualified physiotherapist. He will only be called as a physiotherapist to practice. So dear public, the people who are watching this, make sure that whenever you go to a physiotherapist, whether he is a qualified physiotherapist, he has a recognized degree, and he has a recognized member of the professional bodies, that you ensure in his nameplate, then you go to him. Then, who is this physiotherapist? He is a clinician. Basically, he is a clinician who can diagnose, who can treat, who can do a research on his treatment. So he is a proper clinician for all therapeutic disorders. So there are n number of therapeutic disorders in all 11 systems of the body. Whenever the disorder comes, only profession is meant for the taking care of this any disorder is physiotherapist. So he is a clinician who deals mainly with the disorders. And the second thing is, he is an academician. Okay, most of the creamy professionals, they are all in academicians. They are all the teachers. They are all professors. There are nearly about 1,000 colleges are there in India. In 1,000 colleges, in each colleges, if you say 25 teachers, so you imagine there are so many number of academicians are there in this profession. Then there are administrators. There are again the experienced academicians with their experience. There are many of them are as a principal, as a dean, director, HODs. Okay, so they are all these professionals are having their own levels, like that of any other professions. Okay, so who is this? What these physiotherapists are actually doing? Okay, so what is the role of physiotherapist? So very simple. Whatever the therapeutic disorders comes, okay, a physiotherapist responsibility is that he has to consult, and he should come to a diagnosis, and he should proper plan for the goals of treatment. He should implement the goals of the treatment within the prescribed syllabus of his curriculum. Okay, there are so many therapists in the country who practices other than therapy, other than what they learned. They learn in the short break of time in the form of certified courses, and they start coming. Youngsters, I always insist, even the students where I am working also, I tell them not to involve yourself into such kind of practices. You best account with the skills that what you learned, and you try to implement that. That is going to be the beneficial. That is only physiotherapist. A physiotherapist, what he does for all therapeutic disorders, he makes sure that he practices, he consults, he sets the goals only limited to his profession. Okay, he will not indulge into some other profession. So that is what he is the people. So the physiotherapists there are hundreds of therapeutic disorders, okay, where a physiotherapist can handle. If we talk about the neurological disorders, there are a number of neurological disorders. If there's an orthopedic disorders, there are a number of orthopedic disorders. If you see the geriatric disorders, pediatric disorders, there are so many number of disorders where physiotherapists are challenged enough, competent enough to handle any kind of a challenging therapeutic disorders, which is the only remedy for management of all the disorders. So today, as a part of the role of physiotherapist, the physiotherapists who are gathered here, since it is the theme of this year World Physiotherapy Day, okay, so we are only here to discuss only about the what is the role of physiotherapist in osteoarthritis and how the role of physiotherapist need to be in the form of integration, whether the integration is needed or not for this management of this condition. This is what is we are going to discuss in this panel discussion. This is what is the aim of the things. So we are having the panelists here who are well experienced. I think in the beginning of the function, our master of ceremony people, they introduced the panelists. Again, it is my duty as a moderator to introduce to you that who are they specifically in relation to the profession. Okay, Dr. S. Anand, who is a senior most professor in the panel and who is having experience of more than 25 years of handling the only a community related patients, okay, and his strength is, and he can diagnose and he can intervene at any time of the patients, whoever the patient comes to him, okay. He is proactive in handling the all therapeutic disorders, and he is a what we can say, a pillar in the college where he is working to take this profession to the community. So we as a moderator wholeheartedly welcome you, Dr. Anand sir, for this panel discussion. Then we have a Dr. S. Anand, Dr. Sandeep Shinde sir, who is a senior most physiotherapist, orthopedic physiotherapist and HOD of the orthopedic department in the Krishna College of Physiotherapy, and his area of interest is purely orthopedics, and he involves in the management of many of the orthopedic disorders, and his area of interest is majority of time is osteoarthritis. That is why he has been a panel of, he is one of the member in the panel discussion. So again, I welcome you, Dr. Sandeep Shinde sir, for this. Then we have Dr. Suraj Kanse here, and specially we have invited him because his knowledge on today's discussion is going to be a newer one, because he is only going to give the input on integration, because he has the skills of neurophysiological skills. He is basically a neurophysiotherapist, and it is not that only orthopedic physiotherapist only can manage the osteoarthritis. It is there is a need of an other physiotherapist to be involved timingly. Okay, when the quadriceps strength is not increasing, and it will improve to that particular person. If at all other techniques can be used, of course we should use the next techniques, which is only the neurophysiological approaches like PNF. We can use the any kind of a facilitated techniques. Okay, so that time definitely patients are in need of a neurophysiotherapist. A neurophysiotherapist in this locality is Dr. Suraj Kanse, and he is a representation from the Maharashtra state, and we are very happy to have him as a panelist. Welcome you, Dr. Suraj Kanse sir. Then we have another senior most faculty, Dr. Amrit Kaur Aijade, who is again women's health, especially who treats an orthopedic physiotherapist, especially for women's health, and he has hands-on skills in manual therapy also, and she tries to do always the approaches through manually, even in case of an osteoarthritis. So having her in this panel also very, very important. Welcome you, madam. And we have Dr. Vaishali and Dr. Tripti here. Tripti, we all know that she is a Satara district convener of women's health, and lot of activities alone she is taking in the Satara district, involving the young physiotherapist, dynamic physiotherapist in this locality, and we are proud of her having here. And she is an orthopedic specialist, having a good experience of handling the osteoarthritis patients, and having her as a women's health convener as well as orthopedic physiotherapist. It is our pleasure. Thank you, and welcome you, madam. And last but not the least, and Vaishali Jagtap, who is an orthopedic physiotherapist, shown more interest on community, especially working on obesity women's, postmenopausal women's, and she is more into integration. Okay, she always felt her area of his. So this this condition can be innovatively can be treated like this. So she used to have an integration even with an orthotic departments, even how to she has a better knowledge of how to involve the other professionals in the working area. So it is again our pleasure to welcome Dr. Vaishali Jagtap for this panel discussion. So now we are all opening for the discussion, and even in the online, I sorry to say that miss it. We are not missed, and you are part of the. So we have a Dr. Suvarna Ganvir madam, we have Dr. Ujjwal Ivale sir, who doesn't require introduction, but they are the people who are strongly behind working in this condition. They are very much particular about making this theme of the World Physiotherapy Day, reaching to the unreachable people, and they are behind the supportive of all the such kind of activities in the country. And we have Dr. Rohit Barge, who is again a practicing physiotherapist, especially for osteoarthritis. Pallavi Kulkarni, who is again a neurophysiotherapist, Satara district. And we have Chenmay Deshpande, who is again a community physiotherapist, and taking the creating the awareness in the target population, especially in this locality, like women, how they are getting obesity people. So like this, in the panel, we have a good experienced people all together, and the messages, the output of this discussion is going to be beneficial for all of us. So now I'll open the discussion. I'll start with Dr. Ujjwal Ivale sir, who is in the online. Sir, can you highlight on how this concept is been thought of by the theme of this year World Celebration Day? Dr. Ujjwal sir, can you please highlight on this? Yeah, thank you very much, sir, Dr. Ujjwal sir. We are pleasure to have you as one of the panelists in online. And again, a few inputs from Dr. Suvarna Ganvir madam. Oh, yeah. So, anybody in online, would you like to share your input? Dr. Rohit Parge, can you? Dr. Rohit Badge, are you on online? Yeah. Can you please share on the theme of the World Physiotherapy Day celebration this year and our intention of discussing the topic in the form of panel discussion? Okay. Yes, sir. Yes, sir. Continue. Okay. Thank you very much. So now, I think we heard a few inputs from the panelists who are online. Now I will ask the same questions to the panelists who are here. To start with, I just wanted to ask Dr. S. Anand sir, who is a senior most professor. And sir, what do you think about the theme of this year theme of World Physiotherapy Day celebration, and how important it is for the public?
This year theme is an excellent theme because of the highest prevalence rate of osteoarthritis. It is in the main public domain. It is a mechanical problem, but all the neural, orthopedic, other factors which influence the osteoarthritis, and it complicates the patient. As a community physiotherapist, I thank the whole Maharashtra IAP for promoting, mainly the moderator who has initiated, for supporting the community physiotherapist to work in the secondary level, next level. We have come across many physiotherapists, many branches, around 10 to 12 branches are there in physio. So it is now, it is a main crucial period to work for the wellness of the public domain, for which all the experts and seniors are supporting. For example, one example, I used to ask the neurophysiotherapist always, your support is required instead of a agent working in a muscle, if it works in a neural structure or the neural functions, so that the amount of pain will be too much reduced immediately. So in that way, anything can be done. Our history back, if we see, we have been in Maharashtra, in India, we are the first person for Olympic award winners in wrestling, etc. So what is the time period? Everything they tell, chronic stage only compulsory rehabilitation. Everything has a time period. For neural control, everything they have been working. Today, even the rural public, the rural people, they have been having a high literacy rate. So if I go to the community, they are asking, Mosam kaise hai? I need the help of the ecologist and environmentalist also, going ahead, just for understanding I am telling. So there is a low barometric pressure today, likewise. So there is a compulsory involvement of neuro and ortho and other vascular physiotherapists are required.
Yeah, thank you very much, sir. You have given, you are enlightened us that the theme of the World Physiotherapy Day celebration this year is mainly targeting on the community, where it has to be known to the unknown people who don't know about how this condition is going to come and what is its consequences. So as a senior in the profession, and Dr. Anand sir has expressed is that it is the need of the hour. The theme is excellent, and he has already, as well as he is thanking all the people who are working on this theme. And Dr. Sandeep Shinde sir, what is your idea on this?
Very good morning, Moderator Dr.G.Varadharajulu, all the panelists and all the listeners. Regarding osteoarthritis, we have to see this condition as a whole body, because the multifactorial nature of this condition, starting from its etiology. So this condition not only affects the knee joints and hip joints, but it affects the whole body. and there are multiple factors are responsible for its initiation and worsening. So when you integrate the other specialties like neurophysiotherapy, community, even cardiorespiratory also. So what happens? This condition is having non-modifiable and modifiable risk factors. The non-modifiable risk factors such as female sex, age, genetics, race, these are the factors where we cannot intervene. But there are modifiable factors, mainly the obesity. The obesity is we can say the most important modifiable risk factor. So if we treat obesity, we can control the further deterioration and we can prevent the further damage of this articular cartilage. So mainly obesity management. Secondly, the problem lies in the proprioception, altered proprioception, muscle imbalances and malalignment. For altered proprioception prevents and protects the further damage. The protective response of the body, it depends on the proprioceptive feedback. And the neurophysiotherapists are we can say the best, they can handle the proprioceptive deficits, muscle imbalances and the balance problems which are related. And the malalignment related issues, we can integrate the orthotics and prosthetics also. Malalignment of the spine, which causes, we can say, the abnormal waist distribution. So abnormal weight distribution is again, we can say, the modifiable risk factor. So where orthotics and prosthetics also we can integrate for the proper weight distribution and proper further alignment of the body. Again, we can see for the community, so for patient education, for better understanding of this condition. Just recently, our World Conference of Physiotherapy has said more than 520 million patients are suffering from osteoarthritis. So in a population, 30 to 35% of the people are suffering from osteoarthritis. This is a global challenge. Osteoarthritis is a global challenge. So it requires mass communication. It requires mass education. And that is a duty of community physiotherapists. So they can educate the patient. Educate the patient regarding prevention. Prevention carries 3 levels. Primary prevention. Primary prevention for the people who are at risk of getting osteoarthritis, females, postmenopausal ladies, obesity people, where we can primarily prevent osteoarthritis development. Secondary prevention, the people having history of trauma to the knee joints, articular damage, sports injuries, road traffic accidents, intra-articular fractures. So they are always at risk of getting osteoarthritis in future. So secondarily we can prevent them. So we can reduce the weight, we can reduce the stresses, and we can strengthen the muscles. So we can re-educate the muscles. So this is a primary prevention. At the tertiary level, the people who have already developed osteoarthritis, so they require further rehabilitation. Same patient require the knee joint replacement, knee orthoplasty surgery. So tertiary prevention. So post-operatively, pre-operatively in community health. So in the public domain also. So community physiotherapists have the great role in the prevention and further rehabilitation. So that is why for this challenging condition, we require the integrated approach and team approach. So always team approach, definitely it will be beneficial, and it is proven also. Whenever a team approach, we can handle the patient very well and we'll have the great outcome and good benefit to the community.
Thank you very much, Dr. Sandeep Shinde sir, for highlighting the core intention of today's panel discussion, that the mechanism of osteoarthritis. Okay, it is not only affecting only the affected joint, it affects the entire body. This is the point to be noted by the public, that this particular disorder is not only a disorder which is affecting it is particular specific to the joint, it affects gradually the entire body. The entire system of the body will get altered. So a good input, it is a core area where that requires, that is the case, it has to be integrated. The management of the osteoarthritis should not be go solely with one hand. It should be with multiple hand, and it should be multiple approaches. So Dr. Sandeep Shinde sir, out of his experience, out of his knowledge, and even he is quoted, there are the good prevalence rate, highest prevalence rate. There are so many millions of people are suffering with them, and they need an awareness. They are to be educated. Education in the form of mass education. He has very rightly highlighted on these points, and let us listen from the Dr. Suraj Kanse, who is a neurophysiotherapist here, and who works on the comorbidity or other risk factors for osteoarthritis?
First of all, welcome all the panelists. I would like to thank moderator Dr. Varadharajulu sir for inviting me for today's panel. As a neurophysiotherapist, now today's theme, integrated therapeutic approaches for osteoarthritis, and why it is so. As we all know, as rightly quoted by one of the panelists, Dr. Shinde sir, it's one of the burning issue in today's era. Now, why it is so? If you just go to the records available and literature available in today's date, long back, if you see 20 years before, in 1990s or in 1995, globally the prevalence rate was higher, as it was around about 250 to 260 millions globally, and which has now drastically increased. If you see the census reports of 2020, it has crossed beyond 565 millions globally. Now, when we talk about developing country like India, in today's census and records what we available, more than 180 million peoples living in India are largely affected with arthritis. And out of that arthritis, now arthritis is not just limited to osteoarthritis, there are rheumatoid arthritis, there are gouty arthritis, various variants of arthritis, out of which literature says that there are almost 62 million Indian populations who are affected with osteoarthritis. And now, and that is the reason why I would like to congratulate the Indian Association of Physiotherapists who have rightly used this theme for a discussion. Okay, so as risk factors, if you see, there are various multiple system involvement, as quoted by our moderator sir. There are 11 systems in the body which are directly or indirectly going to affect and could be a risk factor for osteoarthritis. Now, besides muscular problem, there are many factors like diabetes mellitus, obesity, which are nowadays very commonly prevalent largely in this society. If you see diabetes, people who are known case of diabetes for a chronic period of time may end up into osteoarthritis. Now, what may be the mechanism? There are various mechanisms, and generally public would like to know, because prevalence rate of diabetes is also very huge in our population. Now, what happens in diabetes is long-standing chronic diabetes can alter the glycolides which are present in the body. They are going to hamper the cartilages that are covering the joints. And hampering the cartilages is again going to erode the cartilage, which is again going to invite many problems like swelling, effusions inside the joints. So long-standing diabetes also should not be neglected, as that could be one of the very common risk factor for osteoarthritis. And there are very neural mechanisms also involved in which could aggravate the signs and symptoms of osteoarthritis. Now, what happens in every joint? There are complex nervous systems present inside the joints, which are going to facilitate the blood circulation to the joint, which are going to facilitate the cartilage formations to the joints. So, as and when the joint or osteoarthritis progresses, even neurological impairments like joint sensations will be altered, proprioceptions will be altered, because this complex nervous system is going to be involved slowly and steadily. So, role of neurophysiotherapists is also quite important, because problems like joint instability, muscular weakness, joint restrictions can come up. So, as a neurophysiotherapist, we have got to play a role in each and every recovery stages of osteoarthritis. There are generally 4 stages in which we can intervene. And even as what panelists are discussing, our role is more important in preventive rather than solving the problems which are already been set in. So preventive role of, I would say, physiotherapy profession is largely into it. And what is important is to identify which are the target populations who will end up into osteoarthritis. Generally, it's not that osteoarthritis will set in after 40s and 50s. As early as 1920 to 40s, these age groups are also more prone for developing osteoarthritis nowadays. So, role of physiotherapists is increasing day by day, and we are happy to be a physiotherapist and serve the society in relation to that. So, I again would like to thank you, Moderator sir, for inviting me for today's discussion. Thank you, sir.
Yeah, thank you very much, sir, for your timely input. Yes, there are neural factors which are aggravating the symptoms of osteoarthritis, for which neurophysiotherapist requirement is there, and a teamwork, that's integration of the neurophysiotherapist along with orthopedic physiotherapist are going to be beneficial. And the theme of the today's discussion and the theme of the World Physiotherapy Day celebration and its importance were very well explained by him. And let us listen to Dr. Amrut Kaur Raijade, who is a senior physiotherapist and working especially with women's health and hands-on skills. Yes, Dr. Amrut Madam.
Thank you so much, sir. Once again, I would like to welcome all the panelists and all the listeners, as well as the all dignitaries who have joined us here online. Again, this year's theme was one of the wonderful theme, as any person who is taking birth on this planet and who is going to age is definitely going to develop in some point of their life osteoarthritis, because we live in a developing country like India, where people are more involved in the physical, physically stressful occupations. Or there was one study or one survey was done in which it was found that the people who are staying in the mega cities, that is metro cities, or people who are staying in the villages where the population is highest in India, are more prone to develop osteoarthritis of the knee. So that is one of the surprising finding which was seen, and that tells us that we need to be more aware about the preventing strategies which are going to be developed or which are going to be conveyed by the community physiotherapist, as Anand sir and Suraj sir very well said. About the causes, Sandeep sir has already emphasized on it, but still one more surprising finding which as a physiotherapist I find it very much important and everyone should know, is that it was found that all the women who were regularly exercising were having less chances of developing osteoarthritis, that is almost up to maybe 25 to 35%, whereas those women who were not regularly exercising were having greater chances of developing osteoarthritis, and the percentage was surprisingly 85%. So even doing a regular exercises with the proper guidance from physiotherapists can prevent from development of osteoarthritis. That was one of the good finding which I came across. Then going to the next, about the woman's health. Woman goes through the very three important phases of the life where her body is exposed to the major changes. First, when she is in her menarche, that is when she gets her first periods. Second, when she becomes a mother. Again, the hormonal changes are there. And third, when she's in her menopause, when her periods stop. So these are the three phases of woman's life which are going to definitely expose to lot of hormonal changes, and these hormonal changes are definitely going to predispose to the factors which sir and madams sir has already explained, like obesity. One of the major cause of osteoarthritis which makes women more vulnerable and more prone for development of osteoarthritis with the ratio comparing to the men is 3:1. So these are the women who has to, even though they don't have a symptomatic osteoarthritis, they should come and consult physiotherapist, maybe a neurophysiotherapist, orthopedic physiotherapist, or community physiotherapist. And now talking lastly about the manual therapy approaches. There are many manual therapy approaches which works as a magic, like muscle energy technique, myofascial release techniques, in mobilization formats like Maitland's mobilization, Mulligan's mobilization, and even the aquatic exercises which help to reduce the joint reaction forces on the joint, and buoyancy, which is going to help to reduce the joint stresses that are acting, and non-weight bearing exercises are the form of exercises that are going to work definitely as a magic. And I once again would like to tell all the patients who are, although not having, who are above 40 years of age, all the females, all the men who are above 40 years of age, at least should visit once physiotherapist for these, to learn these preventive strategies. Thank you so much once again for giving me this chance. Thank you.
Yeah, so Dr. Amruta Madam is highlighted especially on the person who is born in this earth. In some phase of his life, he is going to experience the problem of osteoarthritis, and especially women are being targeted by nature, and the significant risk factor for OA is obesity, And with so much of statistical evidences, she has highlighted that sir, this kind of a team by the World Physiotherapy Day this year is really much needed, and it has to be taken into serious, and it is that is how this kind of discussion also needed, and it requires integration. So on its importance she has very nicely explained, and let us listen to Dr. Trupti Yadav, who is again a senior physiotherapist working on this discipline. Yes, madam.
Good afternoon, one and all over here. I firstly wholeheartedly thank the moderator sir and all the panelists over here who are present here. On behalf of IIP Women's Cell Satara, I would like to put my gratitude for welcoming us. I would like to focus on one thing is, like, we have heard about the causes of osteoarthritis, obesity's role on osteoarthritis, then the neurological factor of osteoarthritis, and also the manual therapy approaches and the women's cell, women body reactions to osteoarthritis. I would like to bring to one notice is that we had camps which were taken up by our college and roundabout in Satara, and I would like to make a point that more than 50% of the patients were suffering from osteoarthritis in this population. And as we have an integrated approach of physiotherapists working over here, even if these patients, if they are referred early to the physiotherapist, really we can make a great change in their lifestyle. And yes, prevention is also a factor which can be which can help the whole community to prevent the osteoarthritis to go to a next stage. And the integrated approach of physiotherapist can really help in the well-being of the patient. Thank you, sir.
Yeah. So, madam has stressed upon the current evidence that even when we, after the this theme, when we started the camps, and there is evidence of more than 50% people are significantly having the osteoarthritis, that has to be definitely need to be managed integratively so that they will be improving, their prognosis will be good in the aspect of qualitative physiotherapy care. So last again we will listen what Dr. Vaishali madam says about the theme and about this today's panel discussion. Yes, Dr. Vaishali madam.
Thank you, sir, for inviting me over here. I would just like to convey that nearly 15 crore people suffer from osteoarthritis of the knee, and nearly 4 to 5 crore need total knee replacement. And this is because just they are not aware or they don't take preventive measures. Instead of going for the surgical management, if we intervene at the right time, we prevent at the right time, we can prevent the surgical or total knee replacement. And on top, women are more prone to osteoarthritis. This is mainly because of the hormonal changes, because of the menopause. So hormonal changes, basically estrogen level drops down and there is a deficiency. And estrogen is more important for joint stability and joint protection. And when the level goes down, of course the joint stability and joint protection is affected, anti-inflammatory reactions are being damaged or affected, and hence there is chance of degeneration and osteoarthritis. So more prone are women. So we must screen all the patients and then we can go for preventive measures. And mainly when we visit the camps or community level, we have found that there are many women who suffer from this, and most important, people are not aware why the degenerative changes occur and what are the preventive measures. Once the disease sets in, they come to the orthopedicians and then the physiotherapist for the exercises or for the further prescription. But if the disease is screened prior, if the risk factors are screened prior and they are educated, then we can stop this disease at the budding stage itself. Thank you, sir.
Okay. So very nice, madam has come to the end of the first round of discussion, that it is in the need and it has to be seen from the root level, that is from the preventive level, and who are the people who are getting affected, they need to be educated. If you are working at that level, that is called as primordial prevention. If you work at the primordial prevention, this disease can be taken care very well. So after the input from all the panelists, so we wholeheartedly accept that from the fraternity of physiotherapy community in the world, the theme decided by the World Physiotherapy Day is a much needed theme, and this particular condition looked in the direction of integrated approach, and that is again a much needed approach to be followed, and this condition should not be tackled by a single physiotherapist because it is involving the multi-system involvement, and there is a need of integration. And this is what is the first round of discussion the panelists are there expressed, and again we accept and we appreciate the idea of World Physiotherapy Day theme, that it is really much needed. So now we will think furthermore about how do this the measures taken by after the theme has been decided, once it has been published, and there are so many physiotherapists working at the colleges, clinics, their respective centers, corporate hospitals. They are all started about celebration of the World Physiotherapy Day involving the theme on their own. Okay, so some of the known way of celebrations, even what we have done in this locality, also we have conducted a rally and we have conducted a camp, and of course today we are doing the panel discussion. So what do you think about, sir, whether these measures that is being followed for the taking of this theme to the public, is it really worked so far? Dr. Anand sir, what do you say? Is it really helpful for taking this theme to the community?
Yes, the theme is very much helpful. So for this,
the measures that has been taken, like we organized the rally, we conducted the camp, and we are conducting the panel discussion, some of the giving the talks in the mass media. So in which way do you feel, and which is good and which way it could have been beneficial?
In mass media, before this we have all the colleges have worked regarding how to conduct the camps, and they had a integral approach. They had some seminars. So coming back to physiology, if you want to say intra-articular fluid or a swelling, intracellular fluid level increase, or else the decremental levels of progesterone and estrogen creating imbalance in the calcium metabolism. Likewise, every physiological features, accordingly the diet plan is there. So unsaturated, unsaturated fat, or what has to be consumed for elderly or others. So all together we had some discussions in around in many of the regions of Maharashtra. So we come across that we made a panel so that for elderly how to screen, for a youngsters how to screen, or for a woman how to screen, and for a disabled how to screen. For example, a patient who is sitting in a car or a tractors here in rural Maharashtra, they use tractors. They keep the folded completely, elderly person, above 50, 55. And while getting up, he finds very difficult. So ergonomic factors, how to identify, we have made separate charts, and we have implemented finally after correcting all the measures. Then it was found very well that in which ways we will have to work, and the society was very well benefited.
Okay. So the health camp, camps that we have conducted on the screening of the target population at the different areas were really taken the theme of the conference to the society.
Yes.
So what about Dr. Suraj sir? What do you say about this? Which measure is really taken this theme to the society?
Yes, sir. Thank you, sir. So, as sir said, camps are one of the medium which large, at a single stretch we can tackle many people. Okay, so camp is very well one measure which we have followed. Besides that, talks in television setups which have been given by very eminent professionals. I could see on television most of the news channels or even on the commonly visual channels, well-known personalities, eminent personalities from Hollywood, from media, even they were sharing their experiences on what is the importance of physiotherapy in this common disease like osteoarthritis. That also is one of the major which has people came to know there is some role of a physiotherapist. Because mostly what happens in rural areas, physiotherapy itself is a new thing for them. So people watching from rural setups that physiotherapy has got something to do with osteoarthritis is also possible because of camps and television ads, which are one of the very common mechanism of addressing this situation. Yeah.
Especially, I've got an opportunity of watching a video clip mentioning about the fake physiotherapist. Okay, how to identify the fake physiotherapist, how to keep away from them. And that's what in the beginning I said, and people should reach the qualified physiotherapist and you have to get consulted. So really mass media is helpful, along with because the camps, we are meeting the target population in person, and mass media equally it takes the message to the public. So again, that is anybody else wanted to contribute on this measures taken? Dr. Sandeep sir, you would like to even you can suggest the better method even in future we can adopt.
So in this modern world, the power of social media is very well understood by everyone, because people are now getting all the feedback, all the news, all the events on the social media. So our campaigning was on the grassroots level. We have arranged the camps, talks, then we have given the advertisements, various other social media, and social media has a power to reach every household. So in every house there is a patient of osteoarthritis, and many people don't have the access, also don't have the proper knowledge regarding where to consult, what to do. And because of that, some people are consulting, so people are not on the time, they are not going to the hospital, and the condition is getting worse. So now currently there are more than 11,000 registered physiotherapists are working in the state of Maharashtra as per the OTPT data. See, one physiotherapist is educating 1,000 people around him. So we can educate the entire population of the state of Maharashtra. It is a very easy thing. So arranging the camps, going to the rallies, and in a week meeting the people around your locality, in your village, in your city. Just 2 hours we are spending with the community, public, for betterment of public health. So people will recognize you, people will reward you, and people will know the importance of physiotherapy, because physiotherapy is the main treatment for osteoarthritis, starting from the prevention to the complete rehabilitation. So it is our professional duty, ethical responsibility to create the public awareness about this global challenge. So that is my message.
Anything, madam, you would like to address on?
Already Suraj sir and Sandeep sir have emphasized the power of social media, but I would also like to add upon, if like those physiotherapists especially who are treating the celebrities, they should also encourage those celebrities to give the message to general population, because they are easily reachable to the general population. When Shilpa Shetty or Virat Kohli says that physiotherapy is effective, they definitely accept it readily, as compared to the if doctor is telling and telling them the importance that for prevention you have to go to physiotherapist, because the impression what they have created with their talent is definitely have a different altogether what we can say acceptance in their minds. So I believe that those physiotherapists who are working on the metro cities with celebrities and all should take that advantage and of creating more awareness about our own profession. Thank you so much.
Yes. So it is truly happening, because it's needed, because the face value in front of the public is very, very important. If Honorable Amitabh Bachchan, if he talks on our problem, so definitely people will listen. So we have to use such kind of measures also. Madam, would you like to highlight on the measures that is been taken and any added things that you would like to?
Sir, as you said, like the camps which we had conducted, I said that majority of the people are osteoarthritis, and really they were unaware that they have something new or they have something alternative rather than medicine for treating their condition. And when we taught them the exercises, we gave them the treatment, they had a smile on their face which could not be replaced by the anything else. So I think yes, that physiotherapy can be useful for them.
See, especially in the especially in the camp, no, even from the beginning also, even some of my students knows it. Whenever we go to the small village, in a small village we get hundreds of patients. Small village, hundreds of patients sustaining their life like that only. Osteoarthritis significant problem, hai to bhi, they are managing and living like that. So which is again not good at the part of even we become renowned professionals, and we should not allow it to people to suffer like this. Okay, that is why reaching the people and as much as possible is a much needed. That's what is Dr. Madam's, Tripti Madam's opinion. And Vaishala Madam, what did you say?
So I would like to add on that, as you said, ki many people are aware of their pain, but they never visit the doctor at the right time. They feel that it's but natural that as we age or as the geriatric age approaches, we will suffer through these problems, and they just carry on with their daily activities, not visiting the doctor at a proper time. So that is the one of the factor that they take it for granted that this will happen. But they have to be made aware that this condition can be stopped at the right time, it can be prevented, and if not prevented, then it can land into chronic phase. So we have to educate them that this is not the thing which is natural. We have to halt it somewhere. We have to find alternative measures. And not only this, but other problems like knee pain or other conditions which lead to knee injuries may result into osteoarthritis in later life. Even the low back pain which people do take as a granted thing, that may also lead to osteoarthritis someday. So there are many conditions which can lead to osteoarthritis in later phase. So all the things should be treated at the right time so that we can stop it at the right moment. Thank you.
So what Dr. Vaishala Madam is insisting that especially this is a problem with the rural population. Okay, the rural population people, even though they are been having the problem, they are having the what we can say nature of ignoring that. Okay, they wanted to, okay, chalta, it is a part of aging. So now it is not one's fate that he has to suffer, he should live with pains. It is not that we have to take them, we have to go to them and tell them, not necessarily that you should suffer and live. Okay, not necessarily you should ignore and live. Don't take this as a part of aging. Okay, you get old normally. Okay, they don't get old abnormally. Okay, so this kind of education is needed, and especially that's what in cervical spondylosis, lumbar spondylosis, osteoarthritis and all, no, people think that it is a part of aging. As I'm 60 years ho gaya, then I will continue like this. I say rehna wala hai. So this kind of thought, they are having. So it is not that. It is not necessary nowadays. Once upon a time, TK. Okay, when there are people to help and people to guide, and when they can manage, it is a possibility. And why should they ignore? Why should they suffer? So this message has to be taken. That's what is our intention. So now, in the second round, and we just thought of the media and the measures that is been taken for the taking the theme to the people is also suitable, and we are all trying. Our whole physiotherapists in the world, we have tried our level best in mass media, rally, paper advertisement, talks, this kind of panel discussion. Many measures have been used, and with the ultimate aim of taking the message to the public that osteoarthritis is very well preventable, manageable, and it can be, finally it can be rehabilitated. Okay, so this message we have taken into the to the public. Okay, now we all assume that our this year theme, because we also done the rally, we are also given the public talk, we are also conducted the camp. Okay, now we assume that it has reached. the public. Now I am asking you, panelists, so what are all the preventive measures need to be educated to the target population by all the physiotherapists dealing with the osteoarthritis? Preventive measures, please. Dr. Anand sir.
Preventive measures, primordial, and it ends with the tertiary prevention. So we have to work in different levels. All the preventive measures cannot be applied to every population. So the changes happen, and every second the changes may happen, every patient will change. So heat or ice application also, heat, we are giving in physiotherapy wax application, which is the best modality for the chronic patient and for the moderate.
No, sir, we are only talking about prevention.
Prevention.
So when you talk about the preventive, you know that these are the target people.
Yes.
There are a set of postmenopausal women. There are set of geriatric population asymptomatic. There are obese people. Again, they are not yet developed the osteoarthritis. There are prolonged case of diabetes. So how do you help them? How do you go? What are the measures, best measures that you can tackle, that you can be used for the prevention of the osteoarthritis in them?
The main measures, as it is indicated, first is the rest and ice application. If it is acute, or heat application, it will be soothing. It should not irritate the skin. So the awareness campaign includes everything. First is the without, for example, without relaxing the joint. If he is stressing over, or a postmenopausal is doing exercises, she goes for anxiety and a higher degree of pain. So relaxation, and then progressively going for a structured exercise pattern. It is not unstructured exercise pattern, structured exercise pattern as per her physiological and orthopedic status. So a person may have vestibular problem also. So properly how to relax the joint, in a which way, land based or water based, he may ask. So land based exercise is good, non-weight bearing or weight bearing. So it has been, everything has been structured and imparted to the public. Next coming obesity reduction and other behavioral modification, these things also has been used to be carried out.
Okay, sir. Dr. Sandeep sir.
So I will tell you an example of preventive strategies for osteoarthritis in a community-based model. So prevention starts from the screening of the high-risk group. So people, we have to screen for the modifiable risk factors. We have to screen after the assessment. So after screening, identification of the risk. So we can prevent the primordial prevention and primary prevention in case of high-risk group. Who are the high-risk group? Elderly population, obesity, elderly females, postmenopausal females, people with past history of trauma, road traffic accidents, people with history of malalignment at the spine and lower limb, people who are involved in the high impact activities which causes loading and abnormal stresses on the knee joint. So we are screening this population. First, prevention. Prevention is always better than cure. So primordial prevention, primary prevention. So these people at risk of getting osteoarthritis in future. So we have identified them and we are going to modify. So weight reduction program, then alignment, realignment regarding spinal alignment. Then if there are muscle imbalance and correction of muscle imbalances, adjunctive orthotics also we have to consult, orthotic consultation we have to give. Then regarding the other things which are involved in the, for example, patient is having past history of intra-articular fracture. So intra-articular fracture at the knee joint further leads to osteoarthritis. So in that, this patient we are going to treat a secondary prevention. So how to go for secondary prevention? So mainstay is very important, is a muscle performance. So muscle absorbs the abnormal loading by the body weight and by the physical activities. So muscle load, we have to improve the efficiency of the muscles, proprioceptive training, correction of the muscle balances, and neurophysiological approaches will help further deterioration of the articular cartilage. This is a secondary prevention. And people already develop osteoarthritis, which is chronic in nature, which is non-curable. So for them, again, tertiary prevention. So because of osteoarthritis, other disease and disorders may develop. Because of osteoarthritis, spinal problem may develop. Because of osteoarthritis, there are chances of falls and other injuries. So it is a huge economic burden on the patient's family, tertiary level. So for them, pre-operative physiotherapy in case of patient is decided to go for knee orthoplasty, post-operative physiotherapy, and community-based rehabilitation. Supply of the orthotic devices that will help that will reduce the patient suffering. So all the 3 levels can be followed for the preventive approach.
As a part of the role of physiotherapist in the prevention of osteoarthritis, sir was insisting on screen them appropriately, screen them need based. Okay, these people has to be, they are the what we can say, the risk factors for developing the osteoarthritis. You identify them first. Okay, then after identification, then you have to educate them, and after education give an appropriate therapeutic solutions. Okay, lifestyle modification, and even some of the orthotic appliances can be taken to their doorsteps. Okay, and they can modify themselves so that they will aware of, if I am not doing this, they will end up with the osteoarthritis, which required a furthermore managements. That is what is first step, what Dr. Sandeep sir is telling. Let us listen from Suraj sir.
So a very brainstorming session. Things which I would like to add on is, first very important thing is we need to reinforce on what are the risk factors for osteoarthritis. Now, as what everyone are saying, everyone of us needs to know that everyone who is, as what madam says, getting birth on this earth are prone for getting osteoarthritis. And it is not that this is a disease of old age. So for prevention point of view, very important thing is there should be education about what are the risk factors for osteoarthritis. Okay, now I would like to throw a light on some risk factors which are usually not considered as risk factors for today's time is diet. You know, diet is one of the very important factor which itself is one of the risk factor for many diseases and disorders. Like if you see osteoarthritis, what happens in osteoarthritis are inflammatory responses inside the joints, muscle weakness, joint effusions. Okay, so this can be very well precipitated by abnormal diet which we are practicing nowadays. Now in today's era, if you see, junk food have been replaced by the traditional foods what we are taking. But these are due to many reasons, you know, a demand of occupation or stress what we are going through. So diet which we are regularly, or today's generation what we are regularly taking are, if you see common examples like just vada paos or pizzas what we eat, they are full of some ingredients which will throw inflammatory responses inside the body. So these inflammatory responses itself are precipitator for many arthritic changes. Okay, so diet should not be neglected. So diet is equal risk factor for osteoarthritis. So this is something which is not so routinely thrown light of, but we should be equally concentrating on this.
Definitely,
okay,
definitely. Yeah. Thank you for bringing this light to the public, because diet is the very important risk factor. And as sir is very rightly said, we don't bother about what food to eat. So really, thank you. And Amrita madam.
Yes, already everyone has emphasized on lifestyle modifications mainly. That is one of the very important preventive strategy. So Suraj sir has already told that what not to eat actually, which will definitely lead to the one of the risk factor, that is obesity. But what I feel is after 40 it is usually recommended that which already our Indian food system, you know, already has main ingredients like ginger, like eating bananas every day, then having flax seeds as a routine part of a diet, then having ajwain, which are our Indian spices which are routinely available in every kitchen. The intake of these dietary supplements should be increased after 40 by everyone, first of all. Then second thing is definitely doing accurate exercises. So like I already emphasized in the first round that those women who are doing, or those people who are doing exercises are comparatively less prone for developing osteoarthritis. But doing exercises in proper manner is also equally important. Proper warm up and cool down is equally essential to have a good exercise session, which will prevent from injuries. Because if you are injuring, you are again having a risk factor for development of osteoarthritis. So I would suggest, even though you are having a asymptomatic osteoarthritis, that means you have a X-ray changes in your joint, but you are not having any symptoms like pain or swelling. But still, you have to start with your exercise session, because this is the right time. And that too with the, what we can say, from the experienced physiotherapist. Thank you.
Yeah, very nicely. Again, exercise and diet. What to eat, what not to eat, sir has told, and what to eat, madam has told. And especially when you talk about the exercises, she was stressed upon. Nowadays, every individuals in the society, they were aware of that they have to do exercises. And they form their own method of going for walking or doing some exercises, some yoga, all of a sudden they start. How to start also they don't know. What is warm up also they don't know. What is cool down also they know. And it is our duty. It is not their mistake. It is our people. We are exercise medicine practitioners. We should go and tell them that is what we are supposed to do as one of the preventive measure. That is what is madam's idea. And let us see what Trupti madam says about this, about the preventive strategies.
Sir, rightly said by madam that exercise has a role. Nowadays, if we ask the patient that, are you doing exercises? The first thing they say, yes, we are doing. So the form of exercise which they tell they are doing is walking. But a correct set of exercise for correct joints or correct body structure needs to be done by the patients. Not merely running, walking can help, but strengthening of the muscles around the joint has a preventive role. That is what I think in this. And even the lifestyle modification which we are following nowadays in this modern era also has a role in development of early osteoarthritis. If we see the older people, they were sitting cross-legged, or they were doing the work with folded knees, but they were really having very less percentage of osteoarthritis as compared to we people who use more Western toilets and everything. We don't even sit cross-legged. So I think that lifestyle modifications have also added up to the osteoarthritis in the young people nowadays.
So the madam has again continue with Amruta madam and talking about the lifestyle and the food and exercises. Let us listen to Vaishali madam.
Thank you, sir. So far, all the panelists have discussed very well about the osteoarthritis and the preventive measures, rather than that also risk factors. And also screening is important, but people should be aware that we should get screened. Just many a times people do visit, if someone is having diabetes at home, they themselves visit the clinics and get screened for diabetes. Likewise, if the patient has some history or prior generations have been suffering from osteoarthritis, there is a tendency that genetically they will be suffering from osteoarthritis in their life. So they have to themselves go and get screened for osteoarthritis, because they are prone to get osteoarthritis in their later life. This is one factor. And second, I would like to add on that proper footwear is must for every person, because that is also the cause which is leading to osteoarthritis or other problems. Because nowadays we wear footwear of our choice rather than seeing what is comfortable and what is needed for us. So we have to get footwear modification, or we have to go for screening and then analyze what is required. Many people do have flat foot, so according to that their footwear modification is must, so that further things can be prevented at the right time. Thank you.
Very nicely. Again, like how diet like that is again the modifiable risk factor is footwear, okay, which is very common cause for the osteoarthritis. That has been highlighted by Vaishali madam. So now the core idea of the theme of the World Physiotherapy Day celebration is mainly this is mainly having the idea of prevention only. Okay, that is why some of the things that we have discussed and we have highlighted. So about the management, if at all, like to throw an knowledge to the public. So there are two sets of people will generally visit the physiotherapist. Maybe we can broadly if we say the urban patient will visit to an orthopedic physiotherapist. Rural people will visit to an orthopedic physiotherapist for the management of osteoarthritis. So how do you differ, sir, when you are managing with our therapeutic measures? How do you get differ for a rural population and an urban population?
Rural population and urban population depends upon their lifestyle and the way of living. So their socio-economic status, their occupational status, and their demographics, inclusive of their anthropometrics, we have to consider properly. So for all the occupational diseases we are doing, but in spite in a rural, what type of occupations also will differ. Not only farmer, additional many responsibilities they will have. In case of females also, more additional work and additional responsibilities they have.
No. The why I let me be more clear. Yes. Why I am asking this question to the panelist is that in Karad, in Satara district, when we are going for the rural camps, we are getting significantly osteoarthritis patient who never come to orthopedic surgeon also and orthopedic physiotherapist also. They are managing themselves. Such a patient is coming to, suppose in our camp, we have told them, they started coming to our department. Their mindset when you are handling, when you are managing, and an urban patient, no, even in case of a patellofemoral joint dysfunction itself, that patient will come to us. Okay, patellofemoral arthritis होने के बात नहीं है. Starting symptom of patellofemoral joint involvement है तो भी they rush to an orthopedic surgeon, they go to an orthopedic physiotherapist, they get treated, they get consulted. Now you have a challenge with you being in a semi-urban place called Karad, and you are having a rural patients coming to you who are ignored, who are educated recently, they come to you. Now how will you manage?
Yes,
this is the question.
Same thing I am coming to explain to you with an example so that the public can very well understand. See, there are many myths and facts prevailing in the society. Physical activity will damage the cartilage. Physical activity will improve the synovial effusion. But evidence proves that moderate level to mild level to moderate level of physical activity is enhancing and promoting lifestyle properly. Depression till depression these things leads for mainly for postmenopausal women. They take corticosteroids, they go for unnecessary intra-articular injections, hyaluronic acid injection, extrusion, everything. They go for a rehabilitation phase finally. So here the physical activity level only. In a rural public, they are mostly they are active in spite some minor form of condylar mal things or mal abnormalities are there. The middle segment used to be little broader. Knock knees we used to tell in common words. In spite they are sitting, they used to work in the farms. They are continuing their activity, they don't face the pain, they are continuing. So they come in the later stage and we feel the difficulty. In case of obese or sedentary population in many of the computerized environment, urban population, lack of activity, they go for senile osteopenia, those women, or else it happens osteoporosis also, they don't examine this type of osteoporotic ultrasound scans. So early they have the pain and immediately they come. Or they do wrong activities and follow up, immediately they increase the stage to stage 1 to stage 3, they immediately jump. In case of rural, it does not happen. They maintain the flexibility also. Stability is little differed because the lower segments are meant for stability. Flexibility is important for the ligaments. A minor effusion will happen, but the body has the system to heal by its own. Okay. This is not being made aware to the public.
Yes, sir. We got your point. Dr. Anand sir, what is insisting, the rural population, by nature of their activities, they are physically active people and they can sustain the stage of illness limited to that area until and unless it becomes serious. Then only they come to an orthopedic. Now, then only they come to the physiotherapy department. And when they come, of course, we have to follow the symptomatic management. And how that symptomatic management will differ from rural to urban, sir? Sandeep sir.
So patients are having high expectation from the physiotherapist. Once they visit the physiotherapy, they want 100% pain relief. They want their functional mobility to be improved to the near normal level. So we have got the wide range of modalities and approaches are available, and we have to decide which is the best suitable to our patient based on the contraindications, based on the patient expectations. So when the patient comes with a grade 1 osteoarthritis to our department, we have to we can first screen for the modifiable risk factors, focus on the problem list, what problem patient is having. So what are the clinical findings first? So patient is having muscular pain, patient having joint tenderness, muscle weakness, reflex inhibition, proximal and distal malalignments. So we have found the problem list. So based on the first priority was always given to the pain relief. So pain relief with the superficial heat based suitable modality, electrophysiological modality, followed by strengthening exercises. We have to make the patient able to do strengthening exercises after the complete pain relief. So second phase start with the strengthening exercises. This is for grade 1. In the grade 2, grade 3, more pain, joint deformity, we require some adjunctive therapies also. Orthotic devices, we require more deeper hitting modalities like diathermy in that cases. So this pain relief phase lasts for longer time, 15 days to 1 month it lasts. So in this phase, because of the suffering and chronic nature of pain, there are certain behavioral changes in the urban patient and the rural patients also. So we have made one strategy out of our experience. So we are showing them the success stories. Similar patient with a similar problem, known individual, which are well recognized in the society. We have got all the records available with us, their videos and photographs. So we are demonstrating this person is having the same problem, came to the physiotherapy OPD with osteoarthritis, and after the treatment for 1 month, 2 months, this was his recovery state. So these are success stories. So these are one identities, the indicators for success we are showing them. So for better compliance or for long-term follow-up. And for grade 3 and grade 4, so these patients are irreversible damage always there. There is no cure. So they require further advanced management and better to be taken by the orthopedic surgeon and community health people. So this strategy we are adopting in our clinical practice.
Okay. So the stage-wise, the grade-wise illness need to be identified first and go with the appropriate intervention, that is using therapeutic modalities, going for the graded strengthening exercises, and concentrating on the entire body as a single segment and exercising the whole body. All these things are the strategies that is being followed, and concentrating on again it has to be tailored for a rural population which is suitable, and that is being tailored for urban what is to be tailored. So that kind of strategies that will be incorporated at various practicing sectors. Let us listen from Suraj sir.
So a few more points I would like to add to this discussion. Generally out of our experience, there is a wide range of experience we get when we manage rural populations and urban population. First of all, exercise is a medicine. That itself is something new for a rural setup people. So they think that anyways, a physiotherapist is just going to demonstrate some kind of exercises like isometrics or free exercise or resistance, which we usually do in our day-to-day activity. We are doing this. That is majority of times they question back to us.
It's a misconception from the public
yes.
that what exercises they were doing, it is not exercises for the condition. So
yes.
Condition-wise exercises. Yes, sir. Continue.
So we need to first make them aware that what they are doing is okay, is understandable, it is correct, but it is not related to the condition what they are suffering from. So when we talk about osteoarthritis, there are certain, we need to evaluate them in a proper sense. We need to make them aware that what are the causing or what are the reasons why they ended up into osteoarthritis. So majority of time, we don't intervene at the site of injury, but we are managing the symptomatic management. But adding up to the treatment approaches, what Sandeep sir said, nowadays there are many new techniques also evolved in physiotherapy, which has got some direct relation with the site of the injury. or especially in spinal, like we are more emphasizing on knee joint, but osteoarthritis can also involve your spine, your shoulder joints. So we need to first make awareness, need to spread awareness about what are the correct measures of exercises we need to follow, and that is still missing in the general population. So for example, as a neurophysiotherapist, when I see towards osteoarthritis, out of my experience, I've seen many patients who ended up into chronic stages of osteoarthritis, which has got some relation with neural mechanism also. Now, literature today says that a chronic osteoarthritic patients, when we take the MRI sections of brain of a person who is suffering from chronic osteoarthritis, there is shrinkages of neurons in the brain or areas of the brain which are concerned with sensory apparatus. So very surprisingly, we could find that people who are having chronic stages of osteoarthritis, the sensory mechanism itself gets altered because of the shrinkages of the areas of the brain which controls the sensory mechanism. Okay, so this particular condition, as what our moderator sir is continuously saying, is not a one-day story or not a one system involvement or not a one professional. We have to have a multiple approaches, and it should be tailor-made. First, and all the factors like causative agents, right from that point, we need to evaluate and modify the treatment approaches which are available. Yeah.
Very rightly said, sir. Let us listen from Amruta madam.
Okay, the basic difference when we deal basically with the rural population and urban population, what I feel is, the first thing when I was talking about dietary modification, most of the times these dietary modifications are required usually in the urban population, not for the rural. Most of the rural population, they have their healthy habits. Basically like pizzas, burgers and all these things are not much readily available for rural, as well as there is a certain socio-economic gap which is there in rural and urban population, which is maybe the one of the cause why every time we don't give dietary modifications to rural and urban. Then as Anand sir and sir discussed that most of the rural population people will come late, they approach very late to the physiotherapist. So definitely there we need ergonomic advice. So like simple example I will give, like use of commode for your toileting activities, which is again not very much feasible in rural population or villages. So there we tell them to buy a simple foldable chairs which are available, which are cost effective, and they can utilize it instead of having a commodes which are available nowadays in every house in urban area. So these are the few basic differences which we have to make as a physiotherapist when the rural patients come or as the urban patients come. So in terms of females, like women's health, when we talk, nowadays the obesity problem, initially it was more common in the urban area because maybe the availability of the resources, machines and all. But now we are finding it is equally or somewhat near equal in rural population also, because the machines have reduced our efforts basically. And that is the reason why the starting from grinding to washing clothes, everything is readily available in machines. So basically for women's health, approach is not that much modified, but yes, on the basis of environmental restrictions, we have to modify certain things. That's it. Thank you.
Again, a much needed information shared by Dr. Amruta madam. Let us listen from Trupti madam.
Thank you, sir. As everyone said, that the scenario that the urban and the rural, that both of them have a different set of ergonomics needed for the setup. Like urban population, as ma'am said, that they have readily available ergonomic availabilities like commodes and everything, while in the rural population they are less available. So that is a point. I would like to add one thing is nowadays, as media is a boon, we say that it gives it spreads certain things. It also spreads something like when a urban patient comes to us, he comes with a Googled treatment approach. So I want to emphasize that everything that Google says is not right. You have to consult your physiotherapist. So that is a major part where we physiotherapists also face a problem in treating the urban population.
Very rightly pointed out by Dr. Trupti madam is that nowadays the urban population, handling them when they come to a physiotherapist is that they are having the off knowledge about their management of their problem, which is we have to initially we should insist them that it is dangerous for their prognosis. Okay, and for the sake of the just for a change, I would like to tell you that one doctor I read it in the Facebook or WhatsApp only. One doctor in Metro City in his charges board, and he put, if he comes with the without having any by himself, his charges are different. If he comes with somebody has referred him, his charges are different. If he comes with the knowledge of the Google, his charges are different. And knowledge with Google being charged more. If it is 100 rupees, he charges 1000 rupees. Then the patient asked him, why you are charging 1000 rupees? Why not? He told, for you handling, for me it takes more time. So that is why I charge more. So it means they come with a off knowledge. So off knowledge is dangerous. We have to insist them from the day one. Okay. Yes, madam. Continue.
Basically speaking about the rural area, most of the times they visit the orthopedicians where they get diagnosed, and this is one of the experience I would like to share, that the female was been diagnosed with osteoarthritis and she was advised to do knee isometric exercises, where just a plain advice was given by the orthopedician that take a pillow below your knee and press it. That's it. But when I visited to see her, I saw that she was using a pillow, kneeling down on that and pressing it. And she said this has been advised by the orthopedician. So this happens, that you have to prescribe in a right way, better refer the patient to the physiotherapist, where the therapist will intervene, where the therapist can show the right approach. So rather than doing she was not supine at all, she was kneeling on that, and which aggravated her condition. So better you have to refer to a physiotherapist, where the therapist can analyze, where the therapist can prescribe, and also the rural area population is not educated. So we have to train him that way. We have to better ask the patient to visit the clinic and then do the exercises, because mere prescription at home at an early stage is not good practice. So that advice I would like to give to the people.
Yeah. So in this related, the education to the relevant health professionals regarding the prescription of exercise medicine has to be taken first. Okay, we have to go to the relevant health professionals. They can advise the exercises, and they cannot, they have to advise that you need to go to a physiotherapist and do exercises. Only this advice, not to prescribe, not to administer, not to set the dosimetry. So this knowledge we have to build, we have to go and educate all the relevant health professionals, not only orthopedic surgeons. All health professionals are having the lack of knowledge in this. Okay, they were only think that osteoarthritis exercise karna hai. What kind of exercise to be done? That also they will teach. But as Vaishali madam told, they may teach, press the pillow with the help of knees. Then the patient is kneeling on the pillow. So wrong method. So administration of the exercises should be done by the respective physiotherapist. So it is, we should insist the public health related process that man that work, that has to be taken care from the beginning. So now so far I would like to get input from the some of the stakeholders here who are going to take the profession to the society, that the future specialists are sitting here in the audience. So I would like to ask them, do you feel something to be incorporated in the aspect of taking the theme of the World Physiotherapy Day to the society in the aspect of prevention and the management? Anybody can share your views. Yes.
Good afternoon, sir. So my grandmother had symptoms of knee pain. She is suffering from knee pain. So I know, sir, my duty is to work on treatment. So I giving to treatment to my grandmother, and she relieves the pain. So, so my point is, sir, as on occasion of World Physiotherapy Day, we organize the camp in rural areas. So, as Trupti madam said, there is around 50% people suffering from osteoarthritis. So, as a therapist, we work 100% to relieve the pain, and the people definitely is 100% response to come there and educate early.
So anybody wanted to address on the preventive strategies from the stakeholders? There are people in the stakeholders who have experienced in handling the patients. More than 10 years experienced people are also there. Dr. Neeta Pawar, would you like to address on the...
Regarding the prevention of the osteoarthritis, mostly we focus on the osteoarthritis of the knee, and the preventive, it is the maintaining the weight in according to your BMI, that is the body mass index. It is the one most importantly, that is the diet. Everybody has concentrated on the diet. And the third one is the mild to moderate aerobic exercises. It is the most important in preventing the osteoarthritis of any joint.
Yes, yes. During the, once you screen the people, and if you found that they are the target, and aerobic exercises are going to be beneficial. Yes, yes, continue.
Along with the aerobic exercises and the ergonomic advice. That is also important. Everybody should aware of how to use correctly your every joint. That it may be the back, it may be the knee joint. The ergonomic advice according to his profession is important.
Yeah, yes. Most of the people who are getting the early osteoarthritis they are all will be working people. They are active people. Okay, so they need a ergonomic advice as a preventive measure at their workplaces. If he is a driver, if he is a security guard, if he is a farmer, if he is a doctor, if he, whatever is the profession it may be. So occupational specific ergonomic advice can be a contributory preventive approach for the prevention of osteoarthritis. That's what Dr. Neeta is telling. Anybody else wanted to address on the, yes?
Since sir said that any fractures, knee fractures or any other pathology may predispose the patient to osteoarthritis. So proper rehabilitation is very important, which is not prevalent in rural areas. Like they do not go for physiotherapy after fractures. So rehabilitation is important after any fracture or any pathology regarding any joint to prevent osteoarthritis in the future, in the long term.
We have to insist when we are rehabilitating the, like we should not allow a secondary osteoarthritis to develop when you are handling the patients who are having the primary illness. Okay, that is what is the correct, right point from the stakeholders. Anybody else? Anybody wanted to contribute? Nicely, you are thinking in a good line. So now, we have come to the thinking about the management of, and we have a number of managerial strategies when they come to our department, and we follow different for little modified version for rural population, urban population. We educate them. So this and all we do as a part of a primary responsibility of the therapist. Now the newer concept that what we wanted to incorporate in the practice of management of osteoarthritis is that integration approach, okay, which is actually a newer concept. Because why it is newer, sir, the theory is accepted, why it has not been practiced? This kind of question you can ask. Being a senior, then you should be asked me. The reason is, that's what in the beginning itself I told, our profession itself is young profession. Nowadays only people are aware of that. If the patient is having osteoarthritis, through orthopedic surgeon, this will be completely managed by orthopedic physiotherapist. Here knowledge bhi abhi aane laga hai. Okay, very recently. So now integrating the consequences of mechanism of osteoarthritis in the health professionals, okay, and in the patients, it is the biggest challenge in front of us. Okay, now can you come out from each team one challenges to implement the integration approach? Yes, sir.
It is compulsorily to put into practice. It is very difficult, sir. For that only we are having this brainstorming interactions, and the Maharashtra team is very well providing the support. So for example, in simple terms, if I want to tell, only lifestyle modification won't be sufficient. We are the main health professional, we are working for movement into practice, dynamic lifestyle. So behavioral modification, what we teach for the children, behavioral modification, it is not only for a child or a neonate or anyone. So we have to the behavioral modification in the sense, for example, the patient, the physiological signs, vital signs can be monitored. But the neurological signs and symptoms, the patient with the illness, he ignores, or how to monitoring, the proper sense is not there. Still many things are not immediately evident, or he is unable to be aware. So he goes for more complications. So behavioral modifications as per the patient, even if he is 70 or 80, we will have to teach them, and we have to improve his self-awareness regarding his problems, or he may forget once he has a remedy with some agents, pharmacological or non-pharmacological, whatever it may be. So in spite of having arthroplasty done, he may forget about his strengthening. He may fall down. So in this way, behavioral modification in different senses we will have to work, and how to inform the public, or how to bring it into practice in a rural community or a urban community or a working population. For working population, we have made screening and how they should be for a cotton workers or pneumoconiosis or whichever Riedel syndrome or whichever. But for a general public related to the joint stability and promoting wellness, or to completely prevent or maintain the joint function, we have to make more self-awareness programs, and we have to, every awareness we will have to work individually with the integration.
Okay, sir. So there is a practical difficulty when the patient comes to us, and because it is due to the lack of awareness of integration. That's what sir is telling. Let us listen from the team B. Sir, what is the challenges that you feel to incorporate the integrated approach, integrated therapeutic approach, in spite of having the good physiotherapy setups like Krishna Physiotherapy Center, and in Maharashtra, in other good institutions are there, like Krishna. So why can't it be implemented? What is the challenges that you feel?
So I feel challenges at the root level. There are no, for example, I'll give two challenges that we routinely face. Number one is, even when we are discussing today integrated therapy approach, that is our understanding. As a physiotherapist, we have reached to that level. But what is the understanding of community? The big challenge what we are having is still, in spite of 75 years old profession, still awareness about physiotherapy profession itself is a big question mark in certain, especially in rural areas. So challenge will come when people, first they should be aware about there are physiotherapy is a field which is going to be dealt with a health related diseases and disorder. So first challenge is that patient himself, anybody who is getting pain, anybody who is suffering from not only osteoarthritis, any of the disorder, first needs to know that a disorder can be very well handled by a physiotherapist. So that is first a big challenge that is still prevailing not only in rural, even in urban, because we get to see that even urban people, they are more attracted to adjunct therapies. Besides,
surprisingly, even it is not been aware of in health profession itself.
Yes,
they think that this cannot be handled by physiotherapist, and they will not refer only. By some chance, if we get very late time, that is one of the challenge. That's what sir is saying. Yes, sir. Continue.
And second is, as rightly pointed by you, is healthcare professional. Now, even a physician or an orthopedic surgeon or anybody who is doing allopathy practice, nowadays, surprisingly, even we could see Ayurvedic practitioner I could see few setups of Ayurvedic practitioner practicing physiotherapy services in their setup, like Panchakarma along with physiotherapy. But what I mean to say is those people still are not aware about at what point of an or what stage of an injury or what stage of a disease should I refer this patient to a physiotherapist. See, based on the disease and disorder, based on the stages of recovery, we have our own intervention. But the challenge is that we are not receiving those patients from on time. So even healthcare professionals need to be addressed very well about what is the role of physiotherapists and from what stage we can intervene. So that is one more challenge what we are facing.
So, yes, madam. Would you like to add on anything?
Basically, as sir has already covered, basically that patient's point of view, it needs to be like they needs to be more aware, as well as the professionals needs to be more aware. And also the physiotherapists also need to update themselves, I feel, as they grow. Like few of the...
That is the reason why when I'm about to say this, then she will pick up that point without saying. That's why I was hand over the response.
So physiotherapists need to update in terms of like the points which we all discuss, like neurophysiotherapy. When it comes, it is a proprioception that needs to be covered. Community, it is to be the factors which are going to make people.
When we have a good setup of practice of doing the multi-speciality physiotherapy practice, and it is the bound duty of the head of the department, an orthopedic department, neuro department, that my patients, you should know, you should aware of how many osteoarthritis patients are there, how many of them are in which grade, which stage of recovery, who required the help of Suraj sir.
Yes.
Okay, that knowledge should be developed, should be incorporated within the professional itself. That is again, that is in budding stage, which is the required challenge, which can be very well removed, at least a sentence like Krishna.
Yes,
so we have to follow it strictly. That is the intention. Anything, madam, you would like to?
As this is a good opportunity, I would like to also mention about the knee traction device, which is one of the good technique to be given for the osteoarthritis knee patient. Of course, it is been patented under name of Krishna, and this is a good platform to discuss about that as we are talking about integrated management, where teamwork is of course necessary, and of course the knowledge or the new concepts which we have introduced in this field, we can share with all the people, as this is the right platform. And talking about the knee traction frame, which is developed over here, all the people who are suffering from osteoarthritis of knee can join over here, can come over here and have its advantage. It is just a traction device, just like you give for the lumbar traction and cervical traction. It is a device which is applied to the knee joint, and we can give traction to the knee joint utilizing the traction unit, and all the specifications and all the things are available readily at Krishna, so all can take advantage of this. And as it is an integrated part, all will be aware of this device all over India rather, and they can approach to the physician, and they can also prefer or refer the patient to physiotherapist, and physiotherapist can update themselves with the current knowledge. And plus on top, all the therapists and all the doctors should try to add on much more innovative practices to this, so that we can manage very well all the conditions possible. Thank you.
Yeah. So what Dr. Vaishali madam is trying to give the message to the community is that physiotherapy profession is the only profession. I told you the basic reason is we are young. We have potential to develop very much. Okay. And the scope of integrating the other profession into our profession, okay, within the profession integration, and doing some innovations for the betterment of patients. So these are all the highest possibilities are there with the physiotherapist. So the research work we can do, patent work we can do. Okay, you name, because this needs more of the huge scientific gap. available in the literature of physiotherapy. So we people should work on this, and there definitely it is going to become the good approaches to integrate the profession with other profession, integrate within ourselves, integrate with sister concern. So in that way, that angle pe develop ho gaya apparatus traction unit, knee traction frame, which is innovatively followed. We are using it for the patients of osteoarthritis in Krishna Physiotherapy Center. So now, almost we have come to the discussions. I think the stakeholders are very clear with whatever the discussions that we are held. And just I would like to ask again maybe the last question for all the panelists, that do the osteoarthritis patients really required a tertiary care rehabilitation?
Yes, sir. Compulsory it is required, sir. So pain won't stop. The pain, the person, the individual, he can magnify it to whichever extreme level he want. It can go to suicidal also, thoughts. So sleep deprivation will be there. Sleep is there, then again his activity, next day activity. It will land up with loss of work. It will land up with
so how do you handle a chronic osteoarthritis patient and fed up of having the continuous physiotherapy treatment for longer duration, still his pain is not reduced, and as you said, he may think of a suicidal attempt also, and he don't want to live with that pain. So how do you manage them?
So that's why the theme has been working upon the prevention. Even while sleeping, for promoting sleep, we can relax the joint. Tertiary care patients we are treating in the rural area and urban area also. We are able to relax only for it takes a time period, 1 week to 10 days. The pain will subside. Even though the complete synovial fluid exudate is there, he can avoid pain and he will be able to sleep. And there are many instincts we have seen, unnecessarily going for the exudate, they have aspiration, it's being done, and they go for septic arthritis, then recurrent gout, and other, as madam and sir has told, unnecessary food products which without any consciousness they are consuming. The proper form of structured exercise if they do, and they are maintaining very well, it can they can come relief of the pain. So any point of even the cancer pain we are managing nowadays, anesthesia gone to the highest limit. We are working to reduce the anesthesia.
Yes. So the chronic level painful osteoarthritis patients really requires rehabilitation principles to be followed with them. That is what is Dr. Anand sir's opinion on, yes, they required a rehabilitation. Yes, sir.
Okay, to end with, I would like to throw a light on very important area. Nowadays, the concept of prehabilitation is very much important. That is, before the full-blown osteoarthritis patients recommended, as Vaishali madam told, there are almost around 4 crores of people undergo TKR, that is total knee replacement. So the prehabilitation means before going to the surgery, physiotherapy is must. And now we have a strong evidence which suggests that if an individual before going for operative procedures undergoes a physiotherapy, the recovery rate and the pain intensity, the improvement in the muscle strength, everything is really very good as compared to the patients who are not following or not undergoing physiotherapy sessions before going for a total knee replacement. So it is not only that after the operative procedures, physiotherapists will come and give the exercises. Your muscles before ready hand itself should be prepared for undergoing the surgery. That is what is my take-home message.
One important aspect I would like to say is what it would be like if we don't require tertiary care itself. And that is what I think is a golden opportunity for a physiotherapist.
Yes, correct. So if we follow the preventive, if you manage the patient, then output will be, doesn't require a tertiary care rehabilitation at all.
Like how we eradicated polio, a day will come that we could eradicate osteoarthritis also. And,
very nice,
and
very
it,
nice.
it would be only due to the work of a physiotherapist.
No, it is not, it is the potential of therapist.
Yes, yes.
What sir is insisting is, it is not the something to decorate the discussion. It is the potential of the therapist. If you work on preventive measures, if you strictly, you can take care of it. Yes, nicely said. Sandeep sir.
So rightly explained by the Suraj sir. So if with our potential, if you are working, and then definitely we can prevent the patient for further deterioration in the tertiary phase. So tertiary phase, mainly we have to focus on prevention of the secondary complications. Out of osteoarthritis, there are chances of whole body complications. So obesity, sedentary lifestyle, complication of prolonged bed rest or inactivity. So we should have the strategy to prevent the secondary manifestations mainly for the tertiary
Mainly
care.
psychologically they will become dependent. Okay, that person will become dependent. So you should work on the strategies at least to make him functionally independent. Basic activities of daily living पे उनको रखना हम कोशिश करना है. Continue sir.
And then there are various government and non-government agencies working for such people, and we should have the knowledge to refer in time to the government and non-government agencies for further management, for the relief, and for the schemes who are there for the surgery or further rehabilitation. That is also a very important point.
Yeah. Yes.
So it is rightly said by Suraj sir that if we eliminate this tertiary level, that will be boon to the society. So we have to work so that the tertiary level also don't appear in the people's life. We have to analyze the risk factors, screen it, and there only we have to stop it. So all people should get educated, and if rightly needed, they should get exercise at the right time, and they have to have a healthy lifestyle so that they won't go into the osteoarthritis, they won't land up into osteoarthritis. And if they did, then of course, as Sandeep sir rightly mentioned, that we have to prevent the further complications, and for that we have to visit a right physiotherapist who is skilled enough, and then we have to get a right prescription, and of course we have to do all the exercises prescribed on the right time. Just mere prescription won't work. We have to take efforts so that we don't land into chronic phase. Thank you.
Very rightly said by all the panelists that yes, we have to prevent osteoarthritis instead of going for the tertiary care. As Sandeep sir has said that in Maharashtra we have more than 11,000 registered physiotherapists. So if one physiotherapist looks after 1,000 patients, I think there will be a day, as Suraj sir said, that osteoarthritis can also be prevented. And it's the duty of each physiotherapist to take this in mind.
From the stakeholders, would you like to add on anything on rehabilitation? Or anything on the discussion you would like to, sir, would you like to share anything? Anybody from, you wanted to add on any knowledge to the public?
As the osteoarthritic patient is taught exercises and modalities are given in the physiotherapy session, we should also teach him the importance of exercises at home, and we should also teach the importance of exercises and ergonomics to the patient, and make him aware and tell him the importance and dangers if he not do the exercises at home.
So, anybody still wanted to share? Would you like to share? You are.
As we know before, in OA patient there are so many deformity changes happen. So with the what exercise we are prescribing them, we have to teach them the exercises. Along with them, we have to teach them what they are not to do. Means which action they are prohibited to do.
Strict adherence to the don'ts, do's and don'ts, which is again a missing concept in the practically when you are executing our protocol. Yes, correct. So we all have come to the end of the discussion. Really, we never know that time is flying, and we had a very good discussion, brainstorming, true brainstorming good scientific feast we had in this. I think the people who are going to see this definitely going to be benefited. So on behalf of the Satara district branch of IAP and on behalf of Satara district women's cell of IAP and the entire IAP, that I take the privilege of sending this message to all the public for the welfare of their health. Then as well as I request the authorities concerned to take the mission of our this year theme to reach maximum people, even in some other ways also. Just for the knowledge of the Indian Association of Physiotherapists, when we have started organizing when we have started the celebration of World Physiotherapy Day, and we have followed certain slogans which may be the unique among the other slogans in the country. So we just started the slogan. The very first slogan from the beginning of our career in Maharashtra is physical health for all by physiotherapist is the one of the slogan that we follow, that it emphasizes on for all physical health disorders, and physiotherapists are the main people to be consulted. And the second slogan, which is continuous slogan that we added in our rally time during awareness time, is that for all orthopedic problems they have to consult orthopedic physiotherapist. For all neurological problems, they consult a neurophysiotherapist. For all pediatric problem, they consult pediatric. Like that, for all the disorders, since we have a specialist in our field, and I wanted to insist the public to know that they have to go to a respective specialist to get their best therapeutic outcome, therapeutic treatment. That is our slogans. Then other slogans are, we just say that for all the disorders, you take the help of physiotherapist, come out of therapeutic problem. So these kind of slogans we used during our rally to make this theme of World Physiotherapy Day theme of osteoarthritis to the public. So again, wholeheartedly thank the Indian Association of Physiotherapy for giving us an opportunity to conduct this panel discussion, and thank the media who are going to be publishing this important scientific event to the public of this locality, even to the India. So I thank the panelists who are really mesmerized me to listen to them, their views on the topic. Really, you put your 100% effort on this topic and really helped me to proceed on the conducting such a good panel discussion. And thank the stakeholders who are hotly involved and giving your input. And last but not the least, the organizers from the second year of the Krishna College of Physiotherapy students, UG students, and some of the PGs who are MOC, they are all helped us for the successful completion of this panel discussion. I thank one and all for the patient listening.
By now we know how important it is and appropriate it is to know about the osteoarthritis, its preventive strategies along with the management. At the end of the panel discussion, each panelist managed to give us a different insight on today's topic, that was the integrated approach for the osteoarthritis. The immense knowledge provided by each one of you will definitely be beneficial for the mankind in the coming years. Now I would like to thank all the panelists for participating who have joined us online as well as in person, along with the moderator, sir, that joined us today for imparting their knowledge on today's topic. We now declare that today's discussion is over. Thank you all for patient listening.
Before completion, I would like all of you to say the first slogan of ours: physical health for all by physiotherapist. Physical health for all by physiotherapist. Physical health for all. Thank you very much.